I'm Katherine Economy. I'm one of the maternal fetal medicine specialists at the Brigham Women's Hospital, and today we're going to talk a little bit about VBAC, vaginal birth after cesarean section. So for the mothers, there's a much quicker recovery time. Having a vaginal delivery, you're usually home and up and walking in 2 days. You tend to need far fewer pain medications to help control your pain after a vaginal delivery than after a C-section. Most women are able to drive a car sooner, and some women feel that they can bond more quickly with their babies after having a vaginal delivery because they're able to get up out of bed, lift them from their cribs. In addition, there are many medical benefits to having a vaginal delivery, which predominantly have to do with not having a surgery. Every time you have a surgery, you have an incision in your skin and in the fascia, which is the tough tissue that holds all the intestines inside. And every time you have surgery, you are at risk for developing scar tissue and other complications of surgery, such as bleeding, infection, developing blood clots. So if you can avoid these complications by not having surgery, then that would be better for you. Some of the benefits for the baby for having a VBAC, certainly the process of being born vaginally seems to improve the baby's lung function right at birth, and that's probably the major one. So the reason not every woman chooses to have a VBAC are that there is a very small chance that during the process of labor, your scar could separate, and we call that a uterine rupture, which is a big word to describe the opening of your uterus during the process of labor along the lines where the incision was made during your previous cesarean section. If that happens during labor, that can lead to an emergency where the baby would need to be delivered very quickly. In that setting, it's very important to be in a hospital where you have immediate anesthesia available, an immediate operating room available, and so we only recommend trying VBAC in a labor and delivery setting that is accustomed to performing emergency cesarean deliveries. A woman should not have a VBAC if she has a prior vertical scar on her uterus from her last cesarean section. Most scars are transverse, which is across the uterus in the lower uterine segment. But if you know that you have an up and down scar, you shouldn't choose to VBAC. Another contraindication to a VBAC would be any typical obstetric reason for a C-section. So if your baby is not head down, you should have a C-section. If you've had other surgery on your uterus, you should have a C-section. One of the things that may help you decide whether to try to have a VBAC is whether you're a good candidate or not. If you're a better candidate, your chance of being successful is as high as 80%. Some of the things that would make you a very good candidate for a VBAC would be if your last cesarean delivery was because the baby was breech or another presentation that wasn't head down. Another thing that would make you a very good candidate would be if you've had a prior vaginal delivery. You have a very high chance of having a successful VBAC. Lastly, if you go into spontaneous labor, you also have a good chance of having a successful vaginal delivery. Any woman who wants to try and have a VBAC can choose to do so. You and your doctor, your midwife, will have long conversations regarding what your chance of success are, but we are happy to support anyone who wants to try to do this. If you are in a hospital setting where they have access to emergency cesarean delivery and anesthesia, we will keep you and your baby safe regardless of what type of delivery you choose.